Nowadays, diabetes is a very common problem all over the world. It affects people of all ages, from young individuals to elderly population. The World Health Organization estimates that as many as 346 million people suffer from diabetes worldwide. But what exactly is diabetes and how it affects our body? Let's talk in details about these things. Actually, diabetes is a group of metabolic disorders sharing the common feature of hyperglycemia. Hyperglycemia is the condition where the levels of glucose in the blood is above the normal values. Usually when random blood sugar level is greater than 200 milligrams per deciliter, or when fasting blood glucose level is more than 126 milligrams per deciliter, it is called diabetes mellitus. So what leads to increased blood glucose level? Let's see the whole mechanism involved. This happens due to problem in hormone called insulin. Insulin is a hormone produced by beta cells of pancreas. The blood carries the insulin to target cells to produce its actions. The insulin acts on target cells, which are striated muscles and adipose tissues. Insulin increases the transport of glucose from blood into skeletal and cardiac muscles, and to the lesser extent in the adipose tissues. In the muscles, glucose is either stored as glycogen or oxidized to generate ATP. In adipose tissues, it is stored as lipids. But when level of insulin in the blood decreases, the glucose present in blood does not get transported into muscles and adipose tissues. This leads to increase in blood glucose level. This increase in level of glucose in blood causes diabetes mellitus. Based on how diabetes develops, there are two main types of diabetes mellitus, which are type 1 and type 2 diabetes mellitus. At first, let's see what type 1 diabetes mellitus is. This type 1 diabetes mellitus is an autoimmune disease. It means that the body destroys its own cells thinking that it is the foreign body. Isn't it a serious condition? Well, the answer is yes. The body destroys its own beta cells present in pancreas. As a result, pancreas cannot produce insulin. Lack of insulin in the body cannot transport glucose in the blood to muscles and adipose tissues. As a result, blood glucose level rises, and this is called type 1 diabetes mellitus. It is also called insulin-dependent diabetes mellitus. This can affect people of any age. Young individuals having gene mutations usually present with type 1 diabetes mellitus. Now let's see about type 2 diabetes mellitus. The risk of developing it increases with age, and usually older population are affected by type 2 diabetes mellitus. Unlike type 1, it has no autoimmune basis. Rather, it develops due to insulin resistance. So it is also known as insulin-independent diabetes mellitus. The central factor is obesity in this condition. Excess fat in body causes excess free fatty acids, increase in cytokines, and inflammation. As a result, insulin is there in the body, but our body cannot utilize this insulin. The same thing happens. Blood glucose cannot be transported, and level of blood glucose increases. This is known as type 2 diabetes mellitus. This is all about the introduction of type 1 and type 2 diabetes mellitus. We will talk later in another part of video about how it affects our body. Please subscribe and support this channel for more informative video like this.